Let's talk about thigh lift. Obviously, we're in Arizona, and so there's a lot of sun. People want to wear short shorts. You want to wear bikinis, bathing suits, all those types of things. And especially on going on hikes, it can become quite a challenge if if there's a significant amount of extra skin or fat in the inner thighs. I want you to think about this simplistically, again, like the brachioplasty, in as two components. There's fat and there's skin. Anybody that has extra fat that's remaining on the inner thighs or the rest of the thighs themselves, as a matter of fact, that's something that we can take care of very, very easily with liposuction. Depending on how much fat you have, sometimes it may take even a couple rounds of liposuction for somebody that has relatively heavier thighs, but usually we're able to do it in just one. And then we have to deal with the skin. If there's a significant amount of loose skin already, or we think there's going to be a significant amount of loose skin after we do the liposuction, we will probably want to talk about a thigh lift. And there's two ways to do it. Most commonly, we do a thigh lift that it incorporates an incision in the groin line and then coming down to the knee on the inside of the thigh. That lets us address the basically the entire thigh from the groin crease all the way down to the knee. It gives us the tightest skin, the best contour, at the cost of the longest scar. That's always the trade-off, right? The more scar we have, the more change we're able to make. If somebody really doesn't want that scar, or if the skin excess is really near the groin on the inner thigh, then in that situation, a lot of times we're able to get away with a short scar thigh lift where the incision is just in the groin, kind of coming back towards that crease underneath the buttock. If we're able to do that, that's fantastic. And I will try to do that every time if I think that we can get you an adequate improvement with that. It's one of those things where, again, have to see you in person or at least look at pictures before we're able to make a determination about which one of these is going to be the right option for you. And much of the time, these procedures are combined with either a brachioplasty or a breast procedure. The one procedure that I don't think it's wise to combine it with is going to be something like a full tummy tuck, just because then the scars end up kind of close together and we can suffer some complications and wound healing problems. So that's usually the one combination we'll try to avoid. Besides that, most things are on the table for us.